Hello and welcome everybody. Thank you so much for joining us today. Today's topic is Keeping Their Memory Alive, Managing Cognitive Dysfunction Syndrome, presented by Kara Burns. Kara is a licensed veterinary technician with a master's degree in physiology and a master's degree in counseling psychology. Ms. Burns is the founder and past president of the Academy of Veterinary Nutrition Technicians and has attained her VTS in nutrition. She teaches nutrition courses around the world on the VIN Veterinary Support Personnel Network. She is the Director of Veterinary Nursing for the North American Veterinary Community, NAVC, and the Editor-in-Chief of Today's Veterinary Nurse. She was named the North American Veterinary Conference Technician Speaker in 2013 and in 2016. She was granted an honorary VTS in internal medicine in 2011 and an honorary VTS in dentistry in 2012. We welcome Kara Burns.
Great. Hi, everyone. Thank you so much for the introduction, and thank you, everyone, for being here. I don't know if it's morning or noon where you are, but I do appreciate you guys spending the next half hour, 45 minutes with me, especially as we are going to be talking about managing cognitive dysfunction syndrome. And we're going to investigate what that is exactly. And then if I'm a nutrition tech, we are going to focus on managing this disease with nutrition and helping to manage the inflammation part of it with nutrition and with another modality. So stay tuned. We are going to have hopefully a little bit of fun, and hopefully there will be time for questions. So thank you again for being here. So first, a thank you to Sissy Animal Health for having me and presenting these webinars. Pretty awesome that these are being presented for free. You don't see that very often. So thank you, Sissy Animal Health, for your commitment and dedication to animal health and to pet owners and the veterinary healthcare team. So let's jump right in. We know that aging affects every cell in the body. I think you guys are familiar with that, right? Even though our pets might not be showing outward signs of aging, inside every cell in the body, aging is occurring, and older pets' nutritional needs are different. So with advancing age, there is an increased risk of many age-related complications and disorders. And we've talked about some of them, and you've probably heard from other speakers about some of these disorders that are seen more frequently in our older pets. So what are these? Well, some of these changes can include changes to the organ system. So kidneys, the GI tract, joints, immune system, special senses. Also, changes in appearance. The skin and coat of our pets start to become less elastic. They might be drying out a little bit more. And especially in dogs, we can see them going gray. Oftentimes their muzzle, top of their head, their limbs, right? So we also are seeing aging in their appearance. But probably the one that we're going to focus the most on today is their behavior. So the brain is also aging with effects on mental activities associated with thinking, learning, and memory. And those are associated with changes in behavior, social interactions, as well as activities and daily habits. We also see this in humans, and we'll talk a little bit about that as well. So, okay, if we're talking about cognitive function, I think many of us think, you know, what do dogs think about, right? Oh, they want to go out, they want to go in, they want to go out, they want to go in, right? They want to chase their tail. And then what about cats? Well, cats, yeah, we know that cats also have their own special thoughts. Their obsession with maybe imaginary things. They can hear a can opener from about 10 miles away, right? And I'm just having a little bit of fun here. But we know that these are stereotypical thoughts of cats and dogs. So if we were to be a little more serious, what is cognition? Well, it really is how we view and perceive our environment and make choices based on our cues, whether those cues are visual or otherwise. It is Latin. It comes from the word cognito, and think of it as an operation within our minds where we're becoming aware of objects, of thoughts, or perception. And it really is all aspects of perceiving, thinking, and remembering. And so I think you guys can relate because of in the following example that I'm going to give. My dogs, I have 3, and they know the difference between their leashes and harnesses that we use to take them out for a walk, and their leashes and harnesses that we use to take them for an RIDE. And yes, I'm spelling because 2 of them are in the room with me now. So just being able to perceive the difference between those 2 things tells us, as scientists, as pet owners, that yes, there definitely is cognitive function. And I know that you guys probably have just as many examples, but that's just one to get us kind of all on the same page. So with brain aging, we have to talk about some of the declines that come along with brain aging. So we know that old age is a time when diseases are more likely to occur. And often the earlier that we intervene, then obviously the better the outcome. Now, I want to remind everyone that old age is not a disease, but as the cells are aging, more disease conditions are apt to occur. So brain function, we know, declines with age, and cognitive abilities worsen. There's a decline in brain function because we're seeing tissue and behavioral changes. And probably one of the big underlying causes is oxidative damage from toxic free radicals. And we'll talk a little bit more about that. So tissue and behavioral changes, I wanted to show you an MRI. So this is a picture of a healthy older dog's brain. Sorry. You see a healthy cortex on the left, normal size lateral ventricle on the right-hand side. Now, compare that to an older dog's brain that has some damage to it. We see, if you can see here, that cortex, as compared to the other, has shrunken. It's atrophied. It's smaller than the one on the left. And we can also see, actually, on both the right and left lateral ventricle, the increased size. So I think this visual of a cross section from a CT scan is a good one to show us how brain tissue is changing with dogs, cats, humans, with cognitive dysfunction syndrome. Now, many times, cognitive dysfunction syndrome is equated in humans as dementia. There are a number of different types of dementia. Very broadly, that is the case. The causes, et cetera, will be different for the different types of dementia in humans. But we're not here to talk about humans. But I know a lot of people equate doggy dementia with human dementia. So what are we going to do to help with these brain changes with aging? Well, obviously, if I'm talking to you, we're going to focus on nutrition and how to lessen the changes, or maybe extend the time before these changes occur with nutrition. We want to definitely manage the inflammation, because by doing this and by managing risk factors, what I mean by that is some of the risk factors for the disease conditions that we see in older animals. So by doing that, we can improve the quality and the length of life for our pets. And we can also then fight the effects of aging. So what we are talking about in cats and dogs is, or are certain signs. And typically I'd ask you guys, hey, what do you think this means? So let me just bring some up here. We're going to see changes in thinking and activity, interaction. So thinking, maybe your pet is being more confused or becoming more confused by, ordinary things or by surroundings that they've been familiar with. Naps have become more appealing than maybe going for a walk. Interactions, maybe your pet just isn't wanting to socialize with you as much as before. And your pet has been well-trained, been house-trained, potty-trained, whatever term you use, but now they've started to have some accidents. And then their sleep patterns have changed, with maybe more awake time during the night where they're wandering around. Cats oftentimes will vocalize, dogs will as well. So think of this, the acronym here, thinking, activity, interactions, loss of control, and sleep-wake cycle. The acronym here can be TAILS, right? Because dogs and cats, most of them have tails. So for us as pet owners, that's what we want to think about. Now, when you are bringing your pet in to a veterinary hospital, what we then are looking at, same things, but we use a different acronym, of course, right? So, it's DISHA. So what we are then going to talk to you about as the pet owner is, disorientation. So what behavioral changes are you seeing? I is interactions with pet and people, with their family pets, the ones that they live with, and the people that they live with. Are the sleep wake patterns disrupted? Can't say that word. Again, house soiling and activity. So two things, two different acronyms that we're really just talking about the same thing, but just so you know, in case you are talking with someone from the veterinary hospital and they use one or the other of these. But this is what we're using to really try to find out truly what behavior changes are happening in our older pets because of their brain aging. Now, not every pet will develop cognitive dysfunction syndrome, just like not every human being will develop some type of dementia, right? We all know we probably have, a 90-year-old, aunt or someone who's living by themselves, gets around, drives, goes to the store, etc., right? They're cognitively doing extremely well. The same can be seen in dogs and cats. Not every dog and cat will develop cognitive dysfunction syndrome. So, what are some of the things to look for? Well, when your pet dog who knows you, I mean, they're now what, 9, 10, 11 or older, and you know, they go to the wrong door when they need to go out. Maybe you come home and they don't recognize you. You know, maybe might just be a couple of times to start, a couple of times per week to start, and then you may see increasing from there. Barks at night for no reason, or your cat may be vocalizing at night. And so, you know, they're becoming less active, they're having accidents indoor more often. These are the types of things that we're talking about, the behavior changes that accompany cognitive dysfunction. So here you see, you know, a few different dogs that, you know, this one, the one, I think you can see my pointer, is just kind of went to the wrong side of the door and is looking at the corner, the wall in the corner. The one on the far left is, you know, just hanging out under the chair, not really knowing where they are. The one on the right, anxiety, is also a sign or a symptom, a key component, if you will, of cognitive dysfunction syndrome. Because, you know, if a dog is anxious, or if a dog doesn't really know what they're supposed to be doing, and certain breeds are more prone to anxiety, they will become even more anxious. So what about signs in cats? Well, I mentioned, you know, the top left, vocalization, but they might be hiding more than usual. They might be eliminating inappropriately because they forget where the litter box is. They're not doing anything on purpose. None of these are on purpose. It's because they have a brain disorder, cognitive dysfunction syndrome. So with memory impairment, there are over 28 million pets in the US that have memory impairment. 40% of dogs greater than 15 years old have at least one symptom, and 50% of cats greater than 15 have at least one syndrome. A survey of pet owners showed that 75% exhibit at least one sign of either tails or dysha that we talked about. 37% of pet owners observe one or more signs at least several times a week. 32% report 3 or more signs. But here's the thing that I want to get across. Only 12% have talked with their veterinary team at their veterinary hospital. So it's important for us as veterinary team members, but also for you as pet owners to talk to us about that. We absolutely should be, you know, asking some of the questions and going through the tails or dysha list. But we also want to hear from you. You know, this isn't normal aging. This is most definitely changes due to brain aging, but it doesn't have to be the way that it is, because there are things to help manage cognitive dysfunction syndrome. So I hope that made sense. Basically, the veterinary team should be talking to you about this, and if you are recognizing any signs, please talk to your veterinary team about it. So in cats that have at least one sign of cognitive dysfunction, as I mentioned earlier, if they're 15 years of age or more, 50% of those have at least one sign. 11 to 14-year-olds, so not very old cats, they're probably senior, they're not geriatric. 28, almost a third of those have at least one sign of cognitive dysfunction. And oftentimes the symptoms of cognitive dysfunction, as we went through, right, those signs and symptoms can mimic other diseases that are common in senior cats. Inappropriate elimination is a perfect example. If you have a cat that is not always using the litter box, we need to determine, we being the veterinary team and you as the pet owner with the patient, we need to determine what is causing that. Is it something to do with the bladder, the kidneys, joint disease, or is it cognitive dysfunction syndrome? And we are going to ask you a lot of questions to try to help determine what exactly is going on with that cat. So now we're going to talk a little bit about brain tissue. And you're going to see by talking about this, we're going to come back to some nutrients, and we're also going to come back to the assisi loop and how the assisi loop helps to reduce the inflammation in the brain that is leading to a lot of the damage in the brain and then cognitive dysfunction syndrome. So we know that brain tissue is extremely vulnerable to free radical damage. And so this is, there's a lot of metabolic activity in the brain. Think of the brain and how important that organ is, right? The brain, the heart, and the lungs, the big three. The other organs are important as well, but the brain, you know, runs everything. So if there is damage to brain tissue, we can work to help extend what tissue is left. But there's not, as you can see in the last bullet, there's limited regenerative capabilities, okay? And if it's vulnerable to free radical damage, and there's not a lot of protective antioxidants within the brain, then we can see how that is being affected and leading to behavioral changes. So free radicals are, most of them come from our own metabolism, okay? So they're endogenous, and they're coming from our, the mitochondria within our cells. Remember, mitochondria, the powerhouse of the cell? And so the damage done is coming from within our own body. So how are we going to help that? Well, basically, we can institute antioxidants. Also, free radicals are coming from the pollutants around us, radiation, carcinogens. So think about what is causing these free radicals, and then, you know, we're going to talk about antioxidants and how they can, how they are going to help squash the free radicals. Really, just the process of living and the sources of free radicals coming from within our own body. The process of living is dangerous on a cellular level, and it causes aging. So now, normally free radicals are created during energy production, and they're detoxified by the body's natural antioxidant defenses. But what if there aren't enough antioxidant defenses? So free radicals, especially in aging, free radicals produce energy. They're going to generate free radicals as byproducts. We know that antioxidant defenses, which are going to squash those free radicals, decrease with age. And Aged mitochondria, remember those powerhouses of the cell, are then less efficient. They produce even more free radicals, so it's a vicious circle, and eventually the cell dies. So here's just a little visual to try to explain that a little bit more clearly in a visual form. So normal or healthy mitochondria, less free radicals are produced, they're producing more energy. As they age and as they become damaged, less energy is produced and more free radicals are produced. So again, just by aging, just by living, more free radicals end up being produced. So I told you we're going to talk about nutrition. So foods rich in mitochondrial cofactors, what does that mean? It means they are going to support the mitochondria to get less free radicals and more energy. So we're going to try through nutrition or certain nutrients to improve the health of those mitochondria. I know we're getting down into like biology and physiology and you're like, I don't want to, but it lays the foundation for how we are going to help with brain aging. Okay, so just, you guys are doing great, just bear with me. Okay, so, excuse me. So foods rich in those mitochondrial cofactors or supporting the mitochondria are going to improve the mitochondrial efficiency. As I said, decrease that free radical production, and then with antioxidants will result in decreased damage. So this is why I love nutrition, because we can get down to this level and it's nutrients that are helping with all these different disease conditions that we see in our pets. So antioxidants, you know them just as well as I do. Excuse me, you know them, you love them. Antioxidants, by that I mean, vitamin E fights free radicals. Vitamin C inactivates free radicals and it regenerates vitamin E. So a lot of these work synergistically. And by adding these, we can improve brain function. Omega-3 fatty acids, you've probably heard me talk about those before. They're going to help with not only skin and coat condition, but they're also anti-inflammatories. So they'll work well with the Assisi loop when trying to decrease inflammation. And so let's just go on here. So vitamin E, vitamin C, beta carotene, alpha lipoic acid, fruits and veggies. All of these are going to help improve brain function. So to explain it a little more clearly, vitamin E, C, selenium, beta carotene are antioxidants that are working together to basically squash those free radicals. Lipoic acid and carnitine are helping to support efficient energy production and, as a result, generate fewer free radicals. Carotenoids and flavonoids was on that synergistic looking image. Those are antioxidant defenses from fruits and vegetables. And I'm not saying, you take blueberries and throw them in. It's the carotenoids and flavonoids that you get from those that are added to the formulation. And then omega-3 fatty acids, as we already talked about. So we know that our pets are aging. We know that nutrition can help. And it's even been shown at the gene level. So gene expression changes affect key metabolic pathways and body functions. So we know gene expression changes as pets age, and some genes have increased expression and some genes have decreased. That's not important for you to take away. What's important is that the gene expression affects key metabolic pathways and body function, again, including that oxidative stress and free radicals, the inflammatory process, and those genes related to immune functions. Aging is a process that brings about significant oxidation and inflammation, and that's at the core of many conditions of aging. So in human nutrition, you've probably heard the importance of antioxidants. The same is true in pet nutrition, is really what all of this is coming down to, okay? Antioxidants in the diet are going to help reduce the formation, again, of those free radicals and protect against many age-related health issues or behavioral conditions by preventing those free radicals from causing that damage to the cell that leads to inflammation. So bottom line is nutrition can help fight the effects of aging. It can help fight and lead to improvement of cognitive dysfunction syndrome. So we've talked a lot about nutrition. Let's now focus on the assistive loop, because the assistive loop can also be used to manage cognitive dysfunction syndrome. And how is it going to do that? Well, again, the pulsed electromagnetic field therapy delivers a signal tuned specifically to minimize pain, but to accelerate healing. And we've been talking about anti-inflammatories. The assistive loop helps to stimulate the body's own natural anti-inflammatory process while helping to speed the healing of tissues. So talk about an important therapy, an important modality to help, working in conjunction with nutrition to help our pets with cognitive dysfunction syndrome. And you can see some images here. I have some more coming up. Excuse me. But really what it's doing is it's upregulating the production of endogenous, so with the body's own nitric oxide. So here you see some visuals, can be used in cats and dogs. There are certain protocols that your veterinarian will go over with you that will, walk you through the different, what will be best for your pet and your pet's cognitive dysfunction syndrome as to where exactly the loop should sit. But there are different ways, as you can see here, depending on the size of the dog, the size of the cat, and how best to focus that pulse therapy. So we know that the assistive loop helps to improve circulation and accelerate healing, but it's also, as I keep saying, an anti-inflammatory. So it helps to reduce swelling. It helps to take down a lot of that inflammation. And as we've seen over the past half hour, inflammation is part of cognitive dysfunction syndrome. So in conjunction with omega-3 fatty acids, and then the mitochondrial cofactors that will help decrease those free radicals, this is a multimodal approach that really will help your pets or, pets with cognitive dysfunction syndrome. So remember we talked about those signs of aging, okay? And a lot of them, when we're talking about cognitive dysfunction syndrome, are behaviors. So thinking, activity, interactions, loss of control, loss of bodily function at some point, and disruptions in the sleep-wake cycle. Those are 5 key areas that when we're thinking about changes in brain activity within our cats and dogs, the behaviors fall into these 5 areas. So think about this if you do have an older pet, if you have, or as your pets age, because of the sooner that you and the team recognize, the sooner we can start with these sissy loop, we can start with proper nutritional formulation, etc. Because again, we're trying to maintain optimal nutrition, and we've talked a lot about that. We're trying to manage inflammation. And by doing that, we can improve the quality and the length of the pet's life and fight those effects of aging.